Hello, everyone. Let's see, it's been a busy Thursday. Today is March 4th. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our COVID-19 pandemic update. Worldwide, we are over 115 million cases of COVID-19 with over 2.5 million deaths. In Alabama, we're inching closer to that number of 500,000 cases of COVID-19. We're just over 498,000 right now, and 10,094 COVID deaths in Alabama. In Mobile County today, our daily report in partnership with SSI Group is reporting on 36,397 cases. We added 42 yesterday. I promised to check on the number of 68 from March 2nd, and yes, that was just sort of some normal noise in our daily reporting. We had a lab that didn't report the day before, and so everything came in yesterday. So no cause for concern there. We're still running really low. We've had one additional death reported to us. That brings the number of deaths to 739. 6 additional hospitalizations, so the cumulative number hospitalized with COVID, 4,676. And the number of people in the hospital yesterday, we're not quite sure what that is because one hospital did not report yesterday. So on our daily report, we're showing the bar chart shows 43. The current hospitalized shows 57, which is probably closer to correct, but hopefully those values will autocorrect tomorrow if our hospitals all get caught up in their reporting into the AIMS system. So just a couple of things to talk about today. One is just want to remind you that Mobile County Health Department has been doing second dose vaccine clinics this week. We had one on the 2nd, on the 3rd, and we had one today at our Citronelle Family Health location. So people who got their first dose from us on February 4th returned to Citronelle today on March 4th to receive their second dose 28 days after the first. And remember, the Mobile County Health Department second dose clinics are only for people who get their first dose from Mobile County Health Department. So we cannot give second doses to people who got their first dose from other locations because it throws our inventory out of balance. So you must return to the location of your first dose in order to receive that second dose, so that we can make sure all of our second doses go in the arms of people who they're reserved for. So the big news for today is the Safer at Home order was extended. Thank you, Dr. Harris and Governor Ivey, for extending the Safer at Home order through April 9th. So this means that masks are required in public when interacting within 6 feet of people of another household. There are some exceptions, like for people who are very young, people who have trouble breathing, that sort of thing. And masks are required in schools and colleges where possible for employees and students in grades 2nd and above. So again, mask mandate stays in effect through April 9th. There were some changes to the extended Safer at Home order, and I'll just review the changes with you. So here's what's new. For hospitals and nursing homes subject to reasonable restrictions, patients and residents will be allowed visits from as many as 2 caregivers or as many as 2 visitors at a time. So previously it was restricted to 1 caregiver and 1 visitor, but that has been increased to 2. But remember, the individual facilities still can decide on their own to have tougher restrictions. So the Safer at Home order permits up to 2 caregivers or up to 2 visitors at a time, but you must adhere to the requirements for the individual hospital or long-term care facility or nursing home. So that is their decision to make, but they are allowed to permit up to 2 caregiver visits or 2 visitors at a time. Okay, for senior citizen centers, Programs other than congregate meals may resume, but only the ones that are held outdoors, and subject to some guidelines put forth by the Alabama Department of Senior Services. You still want senior citizen centers to make meals available to seniors by curbside pickup or delivery. So still no congregate meals, but outdoor congregate or outdoor activities at senior citizen centers may commence. All right, for restaurants, bars, and breweries. So for some time, there's not really been a restriction on the number of people who can be in a restaurant, bar, and brewery, but you either had to have partitions between parties of different families. So, if you had booths, then you had to put partitions between them, or you had to make sure there was at least 6 feet between tables. And there are some additional sanitation guidelines and rules. Right, what was lifted was the limit on the number of people sitting at a table. So before, it was limited to just a table with no more than 8 people in the party, but now there will be no limit on party size at tables, but it's still required that either have partitions between tables or ensure that 6 feet exists between tables in restaurants, bars, and breweries. Okay, and the last one is summer camp. So before, there was some pretty strict language about the summer camp needing to make sure to enforce to the greatest extent possible social distancing. And now they've changed it slightly to mirror what is used for schools, and that the summer camps may open subject to social distancing and sanitation rules and guidelines. I think it's some language like must make a reasonable accommodation. Let me get it right here. Camps shall take reasonable steps where practical to maintain 6 feet of separation between persons of different households. So that was the change for camps. So good news for some like me. Very happy that the mask mandate was extended just over a month, and some loosening of other restrictions that will make family members and loved ones happy who have people in hospitals and nursing homes and long-term care facilities that they would like to visit. So again, extended until April 9th. So that is good news, I think. So a couple questions, and of course they're all about the Safer at Home order, the extended Safer at Home order. What do I think about the decision to continue the statewide mask mandate at this time? And I'm really happy to see that because, we have seen that the numbers of cases and hospitalizations and deaths is going down. And as someone described it on a CDC call earlier today, this is great progress, but it's not success, right? We are successful in eradicating COVID-19 or in controlling the pandemic when we are back down to pre-pandemic numbers, which, are no cases of COVID-19. So right now in the U.S., we're adding about 50,000 cases a day and about 1,000 to 2,000 deaths a day. And to some people, that may seem like going back to normal. But if you remember just a year ago, those numbers were shocking to the entire United States. So we have made great progress, and I thank everyone for what they're doing to help us get there. But we still have a long way to go to get back to zero, which would be a success. So I really encourage everyone to keep doing your part. It's going to take all of us working together to get back down to zero, to that success measure. So again, wear your mask, stay at home if you're sick, wash your hands, don't congregate, keep 6 foot of distance between you and anyone whom you don't live with. Let's see, and that looks like it's about it. We have gotten some questions on, if there was not a statewide mandate, would the health department issue a local order? We saw some local orders last spring when this first started, sort of as we were starting to get more strict with movement and activities. It's unlikely that there will be local ordinances at this time of the game. I mean, we're a year into it, and travel has opened back up, so it would be have little impact for just, localities here and there to have mask mandates. But we will continue to advocate strongly for those prevention measures that we can control as individuals. We can protect ourselves and protect our families. And I didn't mention it, but the first time you get an opportunity to get a COVID vaccine. All right, that's it for today. We'll talk again tomorrow at our Friday Facebook Live update on COVID-19. Stay safe, everyone.